I really don't know how to introduce Pete Whittaker.
So the plan of action today is a rope solo of this off-width. My two favourite things, rope solo and off-width climbing. I hate them and I love them.
Sometimes we say some climbers are beasts. Well, he is a monster. He's primarily a tribe climber, but he has done some impressive stuff, boulders and sport routes as well. He climbed 8C+, 514C routes, and 8B/V13 boulders. But last year he received a lot of attention because he broke the world record for the longest dead hang. A dead hang is obviously dependent on a lot of factors, including how used you are to lactic acid in your forearm. But it is often considered more a test of mental fortitude rather than strength or endurance. I don't know if you ever tried to do a dead hang for as long as you can, but it's very painful. And in fact, for many people, it happens that you give up way before your... For many people, it happens that you give up before your hands are actually opening up for the fatigue. Also, I don't know if you ever tried jamming and crag climbing before, but it's probably the most painful type of climbing there is. Pizzi! Giù, 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 giù. Ecco qua. Yes, very painful even if you have white boys crag climbing gloves.
Pete's just warming up and we're going to prepare him for the testing ahead. It is just his body that we're preparing, not his mind. I don't know if he's ready for that.
I thought I could add in a little extra for you.
Right.
Which would be all of our tests.
All of them?
In a session.
Is that not what you usually do anyway?
No. No man or woman has ever completed this challenge.
So it really is the world's hardest test. This is harder than Magnus's test.
This is considerably harder than Magnus's.
Harder than Magnus's test, everybody.
Let's talk a bit about pain, shall we?
If this makes me either pass out or throw up, then it's something else, because both of those things I've never done in terms of climbing or passing out. Never passed out ever. So let's see if it happens.
4, 3, 2, 1. Really good scores, really good. On. Come on, keep it up, come on. 4, 3, 2, 1. Off. 1. Off. 2, 1. And time.
The International Federation for the Study of Pain defined it as an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. The definition already is saying that pain perception is primarily a psychological process. In fact, we differentiate between nociception, that is the signal that comes from nociceptors that goes to the brain, and pain perception. Pain perception is a system that allows us to protect ourselves from threats. In fact, without pain, it's incredibly difficult to even survive. There is a disease called congenital insensitivity to pain with anhidrosis that is a genetic disease that leads you to not have those nervous fibers that send the pain signal, the C fibers. There are very few people that live with this disease in the world, but not because it's so rare. It's actually because it's very hard to even get past the first years of life with this disease. Many kids die because of unexpected injuries, like biting their tongue.
What I wouldn't have given to have my child feel pain like we do. I would have given anything.
Not many mothers would say that. It's a strange thing for a mum to say.
It's a strange little club we have. But I think the first real sign was when she was about between 4 and 5 months old. She started cutting her first teeth, and she started biting down on her fingers and really destroying those fingers. She would bite down so hard. She would bite down to the bone if we had let her. I mean, it looked like I compare her fingers to like bloody raw meat.
Confronting the horror of their child seriously harming herself, Trish and husband Steve made the agonizing decision to remove their daughter's teeth.
We thought at that time that removing teeth would allow her to heal, allow her tongue to not be so infected. She was getting so dehydrated and her tongue was so swollen she couldn't drink as a baby at one point.
Because she was biting.
She was biting so hard on the tongue.
Now we know that pain is necessary for survival, but the relationship between the pain system and the stimulus that activated it is very different and not linear. For example, the pain from a paper cut that is in your finger is disproportionately painful compared to the actual damage to the tissue. And on the other side, it happens when you're working out that after a certain degree of time you perceive that your perception of pain and your threshold, your sensitivity to the pain stimulus is decreased. But it's actually much more subtle than this. Differently from other sensory systems, pain doesn't have a designated spot in the cortex or in the brain. Researchers are trying to identify all the locations in the brain that get activated with pain and to design what they call the pain matrix. And this tells us that pain is an incredibly complex experience. The way you perceive pain can be changed by many factors, including your thoughts. The context in which the pain stimulus is placed can have a huge impact on how you perceive it. For example, when you're eating spicy food, you're actually activating nociceptors, that are pain receptors. But the thing is, since you are inside the context of eating, which is pleasurable, you reframe the signal as something that is interesting and even pleasurable. And the same applies to BDSM. In fact, no masochist will actually feel sexual pleasure or pleasure in general by having their foot hit by a hammer. It's the context that is driving the pleasureness of the stimulus. In fact, studies shows that masochists don't actually have any difference in the way they process pain compared to the average person. Some people talk about the pain threshold as the amount of pain they can sustain, but that's actually the definition of pain tolerance. The pain threshold in the scientific research is the intensity of the stimulus that you have to activate the nociceptors, so to actually drive the sensation of pain. So think about, for example, when you're having a shower, how hot or how cold must the water be for you to actually feel pain? So how can we modulate the sensation of pain? Well, there are three main systems: the opioid system, the inhibitory descending system, and the gay theory. Opioids get produced when you do a moderate to high intensity of exercise for a long duration of time. This is what happens after you do 45 minutes of running, for example. But you can achieve it sooner if you do higher intensity exercises. Some studies show that endorphins and enkephalins improve tolerance to lactic acid, among decreasing pain perception and making your breathing more regular. If you would like to activate that system, one good trick that I can give you is to power scream. I already made a video on power screams and how they influence your physiology and your psychology, so don't miss it. The inhibitory descendant system stems from the dorsolateral frontal cortex and from the anterior cingulate cortex and project their axons in the brain stem. And there, they're sending inhibitory signals to noxious stimuli. This is a system that activates depending on our thoughts and feelings. For example, when we're eating, drinking, urinating, and engaging in sexual activity. Now, actually, regular strength training is one of those things as well. But it goes way beyond. Cognitive behavioral therapy has been shown to be effective in decreasing pain perception by changing the thoughts and beliefs about pain. At the same time, mindfulness and relaxation techniques such as meditation and yoga have shown to decrease pain perception and pain tolerance. And then it has been shown that distraction, positive thinking, and especially goal setting is crucial for modulating your pain perception. The more you're motivated, the more you'll be willing to go through that pain, and your thoughts will be changing depending on that. Finally, never forget the basics, that appropriate hydration, sleep, and nutrition are fundamental, and they also impact the way you perceive pain, among keeping you healthy and happy. I hope you enjoyed the episode. If you'd like to support me, please consider to subscribe, and let me know if you'd like to have more videos like this with maybe a bit more neuroscience and small tips here and there. I'll see you in the next video. Stay psyched. For many people... Patata! Smetti!